you've gotten some relief from your adjustments when you've had them, right? So she gets relief from her migraines, from her adjustment, and her back pain. So we're going to give an example of what that treatment looks like. Hey everybody, Dr. Randy, Kalkstein Family Chiropractic. I have Delaney in the office today. Why don't you tell me what's bothering you, and then we're going to do an adjustment video.
I've been having frequent migraines, some lower back pain.
Okay, so she's in for migraines, low back pain. She's a college student, right? Mm-hmm. So she's doing her classes online now, obviously. How long have you been having the migraines? Is this something that's newer for you, or
I've had
they flare back up? Okay.
For a while.
Okay, so we're going to give you an example of a treatment. You've gotten some relief from your adjustments when you've had them, right? So she gets relief from her migraines, from her adjustment, and her back pain. So we're going to give an example of what that treatment looks like. All right, go face down for me. What's going on with your low back, Delaney? Is it radiating down your hips and legs, or is it staying localized to your low back?
Localized.
Okay. And when did that start bothering you?
It's also chronic. But
okay, but it just flared back up again? Yeah, it's been a couple weeks since I've seen you last. All right, so we're gonna start with some soft tissue work. It's a nice gentle pressure, flushing out some of the inflammation that builds up, some of the inflammation that builds up in her low back and her SI joints. And for her, because she has this hyperlordosis, which is like an increased lumbar curve, we're gonna do a little bit of flexion distraction technique. So you can hang on to those handlebars up there, Delaney. And this flexion distraction technique is a good, just kind of like extra stretch for the low back and SI joints. You can see with my hand up here, I'm sort of blocking her spine from coming down, and that gives that extra stretch below the hand. And then we can even take it side to side, so somebody with hip or low back pain, this treatment's excellent for. You okay there, Delaney? Mm-hmm. Okay, just a nice, easy, gentle. You all done with your class?
Yeah.
Just finish up?
Mm-hmm. Just a couple days ago.
So we do a couple reps of this. For the video purposes, you guys can see it at home, but we'll probably do a little bit more when she's done. That's a really good stretch, even for her low back. All right, so we did a little muscle work, we did a little traction. We'll do a little bit more one here at the end, but let's go on your side facing me. Let's get your low back adjusted. Take a nice deep breath in for me, Delaney. Exhale all the way out. Perfect. Other side. Great, honey. Deep breath in, this leg up. Exhale all the way out. Good. She moves really well. Go face up for me. Let me go back on this side. And across these arms. Take a nice deep breath in. Oh, slide down towards your feet a little bit. Deep breath. Exhale, back on my hand. Good. That felt good. That was a good one there. Stay face up. So we got some good movement in her low back and her mid back so far. Let's check her neck out. You get any visual like disturbances with your migraines, or?
I've had auras before, but this one I haven't had any.
When did you have it? Or when did it get real bad?
About 3 days ago. I had it for 24 hours.
Oh. Sore there? Mm-hmm. Okay, so she's really out in her upper neck super tight. What I feel for, it's just a gentle palpation, but you can feel some of the inflammation that builds up around the joints of her cervical spine. So it's just like, and it's added tenderness there. So this patient can really feel it. What happens with the neck is, you may not walk around and have a lot of neck pain all the time because it's a non-weight bearing part of the body. Unlike your low back, you're gonna feel that pressure. But with palpation, if someone presses on it, you're gonna feel a little more tender there. Do her neck here, Ash, real quick. Good. Good. And this one for me, just relax your shoulders. Excellent. So that's her neck adjustment. Okay, we're gonna do a little bit more work on her, but that's the general gist of her adjustment for her migraines and her low back pain. Thanks.